Hi, I'm Dr. Max here in Maxim Medical Robotic Hair Transplant Clinic in Fort Lauderdale, Florida. I've been a hair transplant physician for some time. I did hair transplant surgery for over 9 years. And I started initially back in the 90s during the era that we had the only one option. It was called FUT, or Follicular Unit Transplantation. And during that time, we were looking at best options how to perform FUT, Follicular Unit Transplantation, and it was successful, except, of course, it was more traumatic for patients. So I wanted to record a video talking about two options, FUT and FUE, and my experience with both of those options. So what is essentially is FUT? FUT is a way of getting hair follicles from the back of the head or side of the head by creating an incision and excising the tissue, the scalp, from the back of the head, and then dividing it into individual grafts. There are a lot of devices. You can take a strip with a regular scalpel. You can use several scalpels that are lined in the row that create linear incisions, what they call strips at the same time. Or you can have two scalpels parallel to each other where you set the distance in between, and that's how you decide how much of this tissue you're going to excise. In any way, a hair transplant doctor is responsible for harvesting hair from the back. It usually takes 30 to 40 minutes, the excision and then suture. Slivering, or actually creation of those grafts, happen and usually done by hair transplant technicians. And it's supposed to be done under microscope, where they cut those strips into individual grafts. You can create larger grafts, you can create smaller grafts, and that's what happens when you transplant that. So then hair transplant doctor create incisions based on the drawn hairline, and implantation is done by hair transplant technicians placing individual grafts into pre-made slits with forceps. Now let's talk about what is FUE stands. FUE stands for Follicular Unit Excision. So instead of taking a chunk of tissue from the back of the head, we take individual follicular units the way they look naturally. So you can have follicular units anywhere from 1 hair to 5 hair follicles, sometimes even larger. Those units are naturally bundled together, and that's how they appear naturally on your scalp. So taking those units one by one with a small punch actually removes them the way they intended to be together. So when follicular unit excision was initiated, started in early 2000s, there are not many options how to actually get those hair follicles. Doctors back then, they tried to obtain them using scalp biopsy punches, which the smallest you had probably 2 millimeters. Of course, over years, there was a lot of development, mostly with devices, punches, techniques. There are so many manufacturers right now that offer different, not methods, but instruments how to obtain it. Of course, we use several of them. We use ARTES robotic system, which is somewhat a combination punch extraction, we use Trivellini device, we use NeoGraft, and they all have their pluses and minuses, but they all share the same idea. It's a follicular unit excision. We obtain grafts by using punch. It could be rotating punch, oscillating punch, vibrating punch, but it's the same method for all three devices. So let's talk about advantages of follicular unit excision. Number one advantage, it is less invasive procedure. Instead of creating a scar in the back of the head, cutting the tissue, using Bowie to stop the bleeding, then using suture to close the gap that we created, and then waiting for the scar to heal, which could take some time, we use a small punch, which does not require electric cautery or anything like that, and we just harvest what we need. Theoretically, at least, there is a lesser chance of nerve damage, because when you cut with a scalpel, if you not careful enough, you might damage nerves, and as a result have some problems with feeling part of the scalp. You can have bleeding, you can have infection. All this is true for any type of surgical procedure. But as far as talking about higher or lesser risk, FUE is known to have lesser risk of nerve damage. We actually, by every excision taking a graft, we create a graft which is ready to be used. So it translates, first of all, the physician involved much more than during the FUT procedure. In FUT procedure, the physician harvests the tissue, close the incision, and then it handles and gives it to hair transplant techs, who will finish the process and they create the scalp. Problem with that, we can have good hair techs, very professional, or sometimes less, and this way we kind of increase probability that something will not get done right. In Maxim Medical, we believe that only doctor, only surgeon, and I'm the one who works here, should perform every stage of the procedure. I never delegate anything surgical to anyone else. After those grafts are obtained, they are counted under the microscope, checked for the quality, and being prepared for reimplantation. Other advantages of FUE versus FUT, that we can utilize the entire donor area from one side to the other side, from the top to the bottom. And this is the huge advantage. And the reason is because with FUT, we just limit it to the area of the incision. If we take tissue from the back of your head, but we need to create a nice fine hairline, we only have this bigger, coarser hair, right? For the hairline to look natural, we need to use a finer hair for the transitional zone, the outermost zone with irregularity, and hair from temples will be more suitable. By using FUE, I can actually go and selectively pick. Let's say I need 200 fine hairs for the hairline. I can go and pick. We need 200 follicular units that are suitable for the outermost transitional zone of the hairline. Then I need coarser hair for the dense zone. I can go and pick specifically units that are larger, coarser hair. Number 3 advantage, there are no visible linear scar. By using smaller punches, which now are getting so tiny, less than 1 millimeter, What I use in my practice are 0.9 millimeter punches, either robotically or manually. And those tiny dots are so small, they heal faster, do not create a linear scar. Don't get me wrong, there is no such thing, I want you to understand, as a scarless surgery. It doesn't exist. But by using smaller tools, the scar becomes so tiny that unless you typically use some magnification device, you're not going to be able to see it, especially within the growing hair in the back of the head. By using smaller punches, they heal faster because the less tissue you remove, the faster the growing, the healing occurs in those little dots that we removed. So one of the FUT advantages that's frequently being brought by doctors who still perform follicular unit transplantation or strip procedures is that FUT is faster. And it was true for some time. However, with advancement and developing newer technologies, is becoming pretty much an obsolete advantage. Here in Maxim Medical, we've been developing newer methods and devices that increase the speed of hair graft implantation. Because of using those advanced technologies, I'm able to transplant over 1,000 grafts per hour. So our regular normal day, a 2,000 graft procedure, we typically done around 2 p.m., which is the same as the FUT. So as you can see by now, there is not much of the advantages being left with the strip procedure. Okay, and finally, as I mentioned before, here in Maxim Medical, we believe that only hair transplant surgeon should treat patient, not hair techs, not unlicensed people. And that's why we switched to direct graft implantation, which is done by me. I personally implant every single graft that I obtain. That allows me to be in control of everything what happens in the OR. Instead of me leaving after I took the strip and saying, okay, patient, I will see you in a little bit, and here the hair techs are going to be implanting, I remain with the patient at all times. Follicular unit or direct graft implantation, it's only possible with FUE technique because you take smaller grafts and you use small needles to implant it. And we have a separate topic about direct graft implantation. We'll depict all the advantages, but kind of in a nutshell, same thing about direct graft implantation. Quicker recovery time because there is less trauma, there's no pre-made, and the grafts are loaded into small implant devices by using the top of the graft, and that's a huge difference. When you transplant with the older method, you have to grasp each graft by the bulb, by the lower part. That's the only way you can actually insert it into pre-made incision. Using direct graft implantation, you load those grafts by the top, by the epidermis, so you don't squeeze, you don't damage all the sensitive areas. The most sensitive areas are the bulge area of the hair follicle and the actual bulb area. That's where most of the stem cells located that ensure graft growth. So I hope it answers some of the questions and a lot of frustration because there's so much on the internet, YouTube right now. A lot of doctors, they talking, oh, this method is better, this is method better. There's a lot of proponents, there's a lot of paid actors that will give you false information. In my opinion, each doctor should perform what he's more comfortable, what he's more competent with. Okay, if you go to an FUT mostly performing doctor who does only a few FUE procedures, and you ask, do my FUE procedure, you probably will be better off doing an FUT because he is more comfortable performing that procedure. Same thing about other doctors who only perform FUE, and I think FUT will be a good option there. I personally believe that FUE is very versatile approach. I personally did not reject any patients. If I would delegate it to somebody to, which I never do, to harvest the hair, I would probably will have to reject some of the patients. But because I do everything myself, I know exactly who is the patient, and so far I was able to help pretty much everyone. People who had multiple FUT surgeries and more than 7 scars in the back of their head, I was able to extract hair follicles with FUE method successfully and transplant them and improve looks significantly. Again, this is my professional opinion. You'll probably find some doctors who disagree, and that's where you need to do your own research and understand in depth those topics. I hope it helps to shed some light on very complex and notorious topic, FUT versus FUE procedures. With any questions, don't hesitate to call us 954-945-2909. Visit our website at bringbackhair.com, and we'll hope to see you here for a consultation.